If you are over 50, you have probably heard the same advice repeated for years. Just keep moving, walk every day, stay active, and everything will be fine. Walking is often presented as the perfect solution for aging legs. And to be clear, walking is good for your heart, your mood, and your overall health. But here's the uncomfortable truth most people are never told. Walking alone is often not enough to keep your legs strong, steady, and reliable as you age. Many adults over 50 walk faithfully every day and still notice subtle changes creeping in. Standing for longer periods feels harder. Balance feels slightly off when stepping on uneven ground. Stairs feel more tiring than they used to. These changes are easy to ignore at first. They are often blamed on normal aging. But they are not inevitable, and they are not caused by laziness. They are caused by specific muscle loss that walking does not fully prevent. After age 50, the body naturally begins to lose lower body strength at a slow but steady rate. Research shows that adults can lose 1 to 2% of muscle strength each year, even if they remain active. The muscles most affected are often the calves. These muscles are responsible for pushing you forward with each step, keeping you upright when you shift your weight, and reacting quickly when you stumble. When they weaken, the body loses one of its most important stability systems. Walking does not place enough resistance on the calf muscles to maintain their strength. Most steps during a normal walk are low effort and repetitive. The muscles adapt by doing less work, not more. Over time, this leads to weaker calves, slower reaction time, and reduced balance. This is one of the main reasons older adults who walk daily can still feel unsteady or fatigued. The real danger is not just discomfort. Weak calves increase the risk of falls, which are a leading cause of injury and loss of independence in older adults. Many people assume falls happen because of poor eyesight or clumsiness. In reality, they often happen because the legs cannot respond quickly enough to protect the body. The good news is that this decline is not permanent. The calf muscles respond extremely well to simple, targeted movement. With the right daily habit, you can support stronger legs, better balance, and greater confidence in how you move through the world. Most falls do not happen because people are careless or distracted. They happen because the body is no longer able to react fast enough when balance is challenged. The moment you slip slightly, step unevenly, or turn too quickly, your lower legs are supposed to respond automatically. That response depends heavily on the calf muscles. When they are strong, they act like shock absorbers and stabilizers, keeping you upright without conscious effort. When they are weak, that protective system breaks down. As we age, the calves are often overlooked in daily movement. Walking feels like it should be enough, but it does not challenge these muscles in a way that preserves strength. Over time, the calves lose power and endurance. This directly affects ankle stability. Weak calves mean weaker ankles, and weak ankles struggle to keep the body balanced during sudden changes in direction or surface. This is why uneven sidewalks, stairs, and even getting out of a chair can start to feel risky. Another common sign of calf weakness is early fatigue. Many adults notice their legs feel tired long before their breathing or heart rate becomes an issue. Standing in line, cooking for a while, or walking through a store can feel draining. This is not just a normal part of getting older. It is a sign that the lower leg muscles are no longer supporting the body efficiently. When the calves cannot do their job, other muscles work harder to compensate, leading to faster exhaustion. The long-term consequences of this weakness go beyond discomfort. Reduced confidence and movement often leads people to move less. They take fewer stairs, walk shorter distances, and sit more often. This creates a cycle where muscle loss accelerates, balance worsens, and the risk of falls increases. What starts as mild fatigue can slowly turn into a loss of independence. Many people believe that falls are caused by bad luck, poor vision, or slippery floors. While those factors play a role, they are often not the root cause. The true issue is that the muscles designed to catch the body during a misstep are no longer strong enough to do so. This is especially true in the lower legs. The encouraging truth is that this process can be reversed. The calves are highly responsive to targeted strengthening, even later in life. When they are trained consistently, balance improves, fatigue decreases, and confidence returns. Addressing this missing link can dramatically change how safe and capable you feel in your daily movements. Daily calf raises address several age-related challenges at the same time, which is what makes them so effective for adults over 50. The first and most noticeable change is improved lower leg strength. The calves are responsible for lifting your body with every step you take. When they weaken, simple tasks begin to feel heavier. Standing for long periods, climbing stairs, or walking uphill can become tiring even when your heart and lungs feel fine. Calf raises directly stimulate these muscles and remind them how to work again. With consistent practice, the calves regain strength and endurance. This translates into feeling more stable on your feet and less fatigued during everyday activities. Many people notice they can stand longer without shifting their weight or needing to sit down. This improvement often shows up within weeks because the calf muscles respond quickly to regular activation. Another important benefit is improved ankle mobility. The ankle joint tends to stiffen with age, limiting how smoothly you walk and how well you adapt to changes in terrain. Stiff ankles reduce your ability to squat, step down safely, or recover balance when you stumble. Calf raises move the ankle through a controlled range of motion while strengthening the surrounding tissues. Each slow lift and controlled lowering gently stretches the Achilles tendon and reinforces the stabilizing muscles around the joint. As ankle mobility improves, walking becomes smoother and more natural. Movements that once felt awkward or unstable begin to feel easier. This increased freedom of movement is not about athletic performance. It is about confidence in daily life, whether that means stepping off a curb, walking on grass, or turning quickly without hesitation. Calf raises also play a powerful role in blood sugar management. After 50, many adults experience rising blood sugar levels, even without obvious symptoms. The calf muscles are large glucose-consuming tissues. When they contract, they draw sugar out of the bloodstream and use it for energy. This process does not require intense exercise. Even short bouts of calf raises can activate it. Doing calf raises after meals helps reduce blood sugar spikes by giving the muscles a chance to absorb circulating glucose. Over time, this improves insulin sensitivity and supports better metabolic health. For many people, this simple habit becomes an easy way to support blood sugar control without adding stress to the joints or nervous system. One of the most important benefits of daily calf raises is their effect on balance. Balance is not something you either have or do not have. It is a skill built through strong, responsive muscles that can react instantly when your body is challenged. The calves play a central role in this process. They are among the first muscles to activate when you trip, turn suddenly, or step on an uneven surface. When they are weak, the response is delayed, and that delay can be enough to cause a fall. By strengthening the calves, you improve the body's ability to correct itself automatically. This creates a sense of stability that many people notice without even thinking about it. Movements feel more controlled. Steps feel more secure. Confidence grows because the body feels dependable again. This is especially important for adults over 50, as even a single fall can lead to serious injury and a loss of independence. Calf raises also help slow and even reverse sarcopenia, the gradual loss of muscle that comes with aging. Many adults lose a significant amount of lower body muscle without realizing it because the change happens slowly. The calves are often neglected, yet they are essential for basic functions like rising from a chair, walking longer distances, and maintaining posture. Regular calf training sends a signal to the body that these muscles are still needed, encouraging preservation and even growth. Perhaps the most underestimated benefit of calf raises is their impact on circulation. The calf muscles act like a pump that pushes blood back up toward the heart and brain. When these muscles contract, they help overcome gravity and prevent blood from pooling in the lower legs. This improves venous return and supports healthier circulation throughout the body. Better circulation reduces swelling in the ankles and feet, decreases the heavy leg feeling many people experience at night, and supports better oxygen delivery to the brain. This can lead to clearer thinking, improved energy, and better sleep. Over time, improved circulation also reduces strain on the heart and supports overall cardiovascular health. These benefits do not require intense effort or long workouts. They come from consistent, intentional movement. Calf raises may look simple, but their effects reach far beyond the lower legs, supporting balance, muscle health, and circulation in ways that directly protect independence as we age. Calf raises are effective because they are simple, safe, and easy to fit into daily life. You do not need special equipment, a gym membership, or long workout sessions. To begin, stand with your feet about hip-width apart and place your hands lightly on a chair, wall, or countertop for balance. Slowly lift your heels off the floor, rising up onto the balls of your feet. Move with control rather than speed. At the top, pause for 2 to 3 seconds, then lower your heels back down slowly. This controlled lowering is just as important as the lift itself. Start with 10 to 15 repetitions and see how your legs respond. Most people do well with 2 or 3 sets, once or twice per day. The movement should feel challenging but not painful. Barefoot or supportive shoes both work well depending on comfort and stability. The goal is steady, consistent practice rather than pushing to exhaustion. As strength improves, you can increase the challenge by holding the top position longer. A 5 to 7 second hold increases muscle engagement and improves balance and circulation. This longer hold also trains endurance, which helps during real-life situations like standing in line or walking longer distances. Once this feels comfortable, some people choose to try single-leg calf raises, lifting one foot slightly off the floor while rising on the other. This adds a balance component, but it should only be attempted when you feel stable and confident. It is important to listen to your body. If you have had recent surgery, severe balance issues, nerve problems, or conditions affecting your feet or circulation, speak with a healthcare professional before starting. Even gentle exercises can have effects that need to be considered for individual situations. The real power of calf raises comes from consistency. You do not need to train like you did in your 20s to feel strong again. You need movements that support your body where it needs it most. A few minutes a day can strengthen your legs, improve balance, and support circulation. Over time, this simple habit can change how you move, how confident you feel, and how independent you remain as you age.